Hi, my name is Daniela Durolo, and I will be doing an IV insertion and discontinuation in the IV. I have my badge on and my Nightingale scrubs. In order to do the insertion, I would look into the MAR, see why the patient needs it. So I'm going to go into the patient's room, hand sanitize my hands, and introduce myself and verify patient's name. Closing the door for privacy. Hi, my name is Daniela Durolo. I am the nurse helping out doctor today. I will be inserting an IV into your arm for dehydration. Can you please verify your name and birthday for me? Okay. Looking at the wristband, what was verbally said is identical to what is on the wristband. Do you have any allergies? Do you have any questions for me? No? Okay. So this process should take about no more than 10 minutes. Let me know if you have any questions. So first I will get the saline flush. And then I will get the IV extension set and put the saline in there. We are going to prime the line. Priming the line means making sure that there is no bubbles or air in the line. So we will push it until we see water coming out. Once we have that, we can go ahead clamp and set it down. Next, we will apply the tourniquet. When applying the tourniquet, it should be 4 to 6 inches above the site that we're going to do. The tourniquet should be tight enough, but not tight enough that we lose distal pulse. So once the tourniquet is on, we will check the distal pulse. Patient does have a distal pulse, so we can continue. Next, we will do the alcohol prep pad. We will do a circular motion from small to big and let it dry. Once we have that, we will put our non-dominant finger. It will need to be 1 to 2 inches away from our insertion site, and we will pull the vein taut towards me. Now we are ready to do the needle insertion. So we will be using a 20 gauge 1-inch needle, removing the cap. When we do the insertion, the bevel side should be up, and then we will enter the needle at a 30 to 40 degree angle, and then proceed to move it forward until we see some flashback. Once we do that, we will just make the catheter keep going about 1/4 of an inch. So here we go. Okay, 30 to 40 degree angle. Now I see flashback. Now I will put the needle more parallel and just move the needle in place, and the catheter will go forward. Okay, once that has happened, I will anchor the catheter with my non-dominant finger. For learning purposes, the needle should be retracted, but I will just put it in the sharps container because I need to use it again. I will loosen the tourniquet and remove it. From here, I will insert the tubing. Once I have that, I will unclamp and I will aspirate to see if there's any blood flashback, and there is. So now I will slowly push the saline into the patient. Once that has been completed, I will do the clamp again and remove the saline and dispose of it. And then I will apply the Tegaderm. For learning purposes, I will just apply the Tegaderm all intact because it is my last one. So putting it on like this. I will, so in real life, we would take off the back and then apply it to the skin firmly and smoothly. We would remove this top white part and we would label on it with a piece of tape. We would put my initials, the date, the time, and that it was a 20 gauge 1-inch needle on here. After we have done that, we will also tape the other end above and secure it. Before I leave, I'll look at the site through the Tegaderm window, make sure everything looks okay, ask the patient if they need anything, give them the call light, and now I will clean up my area of anything that's not needed. Remove my gloves, hand sanitizer, exit the room, and go document what I did. To do the IV removal, I'll enter the room once again, verify patient's name and birth date, and give them privacy. So, hi, my name is Daniela. I'm here to remove your IV. Can I please have you verify your name and birthday for me, please? Patient has verbally stated a full name and birthday, and it is the same as what is on the wristband. So I'm here to remove your IV. This should be a quick process. So first, what I will do is remove the Tegaderm from the patient's skin and holding the catheter. Next, I will get a piece of gauze, fold it in half, and apply it above just the tip of the catheter and pulling it parallel to the skin, nice and slowly pulling it out. And now applying pressure now that the catheter has been removed. Go ahead and remove the other end from the skin. While you're holding this part for 30 seconds, look at the bevel, make sure all is intact and looks good, and then dispose of it in the sharps container. Now that 30 seconds has passed, we will remove the gauze, look at it, make sure there's no more bleeding, and dispose of that gauze. Grabbing a second gauze, folding it in half, we will apply it to the site and tape it down. Here we have completed the discontinuation of the IV, and we will remove my gloves. Perform hand hygiene. All right, now I've completed the removal. Do you have any questions? No? Okay, here's the call light, and I'm gonna exit the room. Now that I'm leaving the room, I will go document my, my process. Thank you.